Docusate calcium is used to treat occasional constipation. It is often the first method used for preventing and treating this type of constipation. It is also used when straining to have a bowel movement should be avoided, such as after a heart attack or surgery. Docusate is a stool softener, which means it works by increasing the amount of water the stool absorbs in the gut, making the stool softer and easier to pass. Relief is usually seen in 1 to 3 days with this medication. It is important to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. When taking Docusate calcium, be sure to read and follow all directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. Take this medication by mouth, usually at bedtime with a full glass of water or juice, or as directed by your doctor. The dosage is based on your medical condition, age, and response to treatment. If you are using the liquid form of this medication, measure the dose carefully using a special measuring device/spoon. If you are using the drops, measure the medication with the dropper provided, or use a dose measuring spoon or device to make sure you have the correct dose. Mix the syrup, liquid or drops in 4 to 8 ounces of fruit juice, milk or infant formula to prevent throat irritation and mask a bitter taste. Use this medication only when needed. Do not use this product for more than 1 week unless directed by your doctor. Do not increase your dose or take this drug more often or for longer than directed. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. If you experience stomach pain, diarrhea, or cramping, or an irritated throat, especially with the liquid or syrup forms, let your doctor or pharmacist know right away. However, many people using this medication do not have serious side effects. If you experience rectal bleeding or a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. Remember, your doctor has determined that the benefits of this medication outweigh the risks of side effects. If you notice any other effects not mentioned here, contact your doctor or pharmacist. As for the best time to take this medication, follow your doctor's instructions and dosage. And remember, if you have any concerns or questions, always consult your healthcare provider. Before taking Docusate calcium, make sure to let your doctor or pharmacist know if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. If you have severe abdominal pain, nausea, vomiting, or a sudden change in bowel habits over the previous 2 weeks, be sure to consult your doctor or pharmacist before using this medication. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, make sure to tell your doctor before using this medication. It is unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. When taking Docusate calcium, it's important to follow the recommended daily dosage and take it at the optimal timing for the best results. When taking Docusate calcium, it's important to be aware of potential interactions with other medications. This is because drug interactions can affect how your medications work and increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. One specific product that may interact with Docusate calcium is mineral oil. Be sure to discuss with your healthcare provider if you are using mineral oil or any other medications while taking Docusate calcium. If you or someone else has taken too much Docusate calcium and has severe symptoms like fainting or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center for assistance. In the U.S., you can call 1-800-222-1222 for your local poison control center, and in Canada, contact your provincial poison control center. This medication should not be shared with others. It is important to attend all medical and lab appointments while taking Docusate calcium. To prevent constipation, it is recommended to consume dietary fiber, drink plenty of water, and engage in regular exercise. Docusate Calcium should only be used for temporary relief of constipation. It is not advisable to use this medication for an extended period of time to avoid dependency on laxatives. If you forget to take a dose of Docusate Calcium, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. It's important to store Docusate Calcium at room temperature, away from light and moisture, but not in the bathroom. Keep it out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.